Hi everyone, my name is Genesee and I'm partnered with Peyton and Aaron. Our topic was infant health and mortality with Afghanistan and Iceland. Just an overview of the topic. So approximately globally, there's 2.3 million children that die within the first 28 days of their life, and that was from 2022. The leading cause of death includes premature birth, complications, neonatal infections, and congenital anomalies. Poverty, poor nutrition, and insufficient access to clean water and sanitation are harmful factors. Also, insufficient access to quality health services. Inadequate social and economic development are indicators of preventable death, poor health, and well-being of newborns. So, an overview of Afghanistan. In 2025, they currently have a population of 44,515,763. In 2024, Afghanistan had about 43.45 deaths per 1,000 live births, and they currently have about 42.287 deaths per 1,000 live births. And the most common death in infants in Afghanistan are birth defects, preterm birth, malnutrition, SIDS, traumatic stress, fetal infections, infanticide, and abuse. And then an overview of Iceland. Iceland has a population in 2025 of about 380,010. In 2024, Iceland had an infant mortality rate of 0.966 deaths per 1,000 live births, and they currently have 0.927 death per 1,000 births, and majority of the births or of the deaths are caused by cord complications and or placental insufficiency. And that is also included with stillbirths. So, some major issues in Afghanistan is that the population is pushed into poverty. 28.8 million people are in need of humanitarian aid. 17.2 million people are facing crisis or worse levels of food insecurity. And Afghanistan is ranked 170th out of 170 countries for women inclusion, justice, and security. In December of 2022, they banned women from attending universities, and children are at an increased risk of starvation, malnutrition, and hunger, and preventable diseases. Some more health system issues in Afghanistan is many people don't have access to primary or preventative care due to the instability of the healthcare system after the decades conflict. So that's with the Taliban coming back into power. So for every 10,000 people in Afghanistan, there's 2.5 healthcare workers. Public hospitals are free but busy and they limit resources. In Afghanistan, there are 3,472 active healthcare facilities, and that was as of 2022, and 725 hospitals. So 207 of those are public hospitals and 518 are private. There's one public health center for every 11,600 people. When the Taliban came back into power, they shut down about 2,000 of the healthcare facilities, so that also limited the number. In 2018, they did a survey with women for pregnancy, and 35% of the females report no prenatal visits. 14 had one prenatal visit. 21% had four or more prenatal visits. 41% of women report giving birth at home, and over half reported having no postpartum care. Major issues in Iceland. So the legal framework remains one of the best in the world and provides effective protection of property rights. The economic freedom score is 70.5, so it is mostly free. The economic freedom score is the ability to make economic decisions without the government. Um, Healthcare is accessible through Icelandic Health Insurance Fund. Users make contributions monthly and then is capped. Waiting times for specialist treatments may be long, like elective surgeries. There are a total of 6 public hospitals with the country divided into 7 healthcare districts. And one thing that I found with prenatal care for people in Iceland, is that it is free to all women because they want to promote health of the pregnant woman and the fetus.
Okay, this slide compares the infant mortality rates in Afghanistan and in Iceland, and the large contrast between the two. So as you can see, Afghanistan has an infant mortality rate of 45 per 1,000 live births in 2022, while Iceland only has 2 per 1,000 live births, which means that Afghanistan's IMR is almost 23 times that of Iceland's. Um, so in high income countries like Iceland, advanced neonatal care, widespread prenatal checkups, and strong public health programs helps keep this IMR rate low. So it just shows the urgent need for these global health interventions in countries with high infant mortality. And then now that we understand how severe Iceland or Afghanistan's infant mortality crisis is, we can discuss some global health initiatives. So some successful programs that I researched, one was the Healthy Start program, which is focused on improving the mother's health, and reducing the infant mortality rates. So for Afghanistan, a similar program could be like to enhance prenatal care, because like Jenna said, many mothers don't have any prenatal care or have maybe like limited nutrition support, and then safe delivery practices like classes or anything like that. And then the WIC, the Women, Infants, and Children program, just provides free healthy foods, breastfeeding support, and nutrition, and educates mothers. In Afghanistan, a similar initiative would be to combat the malnutrition that people are facing in Afghanistan currently, which is the leading cause or a leading cause of infant deaths. And then telehealth, one of Afghanistan's biggest struggles is access to healthcare professionals and the lack of healthcare professionals, especially in the rural areas. So telehealth can help bridge this gap, and connects patients to doctors in places where they may not otherwise have those connections. And then if these global health initiatives were expanded to countries like Afghanistan, we could significantly lower infant mortality rates and improve maternal and child health. Um, so yeah.
Okay, hi. So next we're just going to talk about how infant death and mortality affects nursing practice. So I think to get to the root of it, we have to know some barriers to healthcare in both Afghanistan and Iceland to truly understand what needs to change and yeah, with respect to the discipline of nursing. So first of all, just looking at the barriers to healthcare in Afghanistan. Um, like Jen already talked about, there are both private and public hospitals. Private hospitals are expensive, but they do provide high quality care. Public hospitals, they're busy, they have limited staff, and they have limited resources. Um, Another thing that I found on the Minnesota Department of Health was just that culturally in Afghanistan, people do not seek care unless something is really wrong. So coming to the doctor just for a prenatal checkup probably is just against cultural norms. Something else that I found is that 87% of women need permission from a male relative, such as their husband or a father, to seek health care. And also transportation is just not readily available in Afghanistan for everyone. Barriers to healthcare in Iceland, kind of like we've already discussed. Um, the system in Iceland is just overall better than Afghanistan. But one of the big barriers that I came across was just that migrant women just don't receive the same level of care as native, like born Icelandic women. So some of the barriers that they face is that they just don't receive the same respect. They don't have the same autonomy of decision making, and they don't really have access to reliable information and teaching, specifically about just childbirth and planning and that sort of stuff. So yeah, one more barrier that I came across was just in the hospital setting. For all women, they have reported having less autonomy of decision making and inadequate teaching to receive informed consent. meaning basically some women feel like they have been coerced into making decisions without really understanding what they're signing. So, yeah. Okay, so then just looking at the application to the discipline of nursing, we'll look at patient care, teaching, and then guidance of practice in both Afghanistan and Iceland. So in Afghanistan, I think really nurses need to understand just the cultural differences in order to properly treat patients. So especially understanding like what affects people seeking care, such as their financial and family situation, their access to transportation, and general cultural customs around medical care. Uh, you can find these outlined in Lisa Lee's papers published by Virginia Med. One study outlining healthcare and birth outcomes in Afghanistan found that postpartum depression is especially prevalent among Afghan women at around 61%, and this is related to a lack of pre or postnatal care. Another thing is in considering how people perceive the attitudes and behaviors of healthcare workers in Afghanistan, one way nurses can really like make a difference is just by simply having better attitudes when interacting with patients, because it could improve motivation for return visits, especially with that prenatal care, which we've kind of already discussed is just really important. So yeah, this also has the potential to allow women to receive just more preventative care, which, like I said, could be prenatal visits, but it could also be just helping with maternal nutrition and also building relationships that aid in safe birth experiences and so on. As for teaching, I think one of the most important pieces for nurses to teach patients is just about why prenatal visits are so important. And this can also just improve motivation for seeking care. Patients should also receive teaching about safe delivery practices, just so that they know what kind of care to seek. I think nurses need to understand that patients may not be able to get to a quality healthcare facility due to a lack of transportation or geographical access. So that's teaching that the nurses need to receive. And I think that this also leaves room for healthcare workers in general to consider how they can deliver care and education to these populations. And the Afghani government has been led to feel the same way. So they've also been making some big changes in that regard, especially as sanitation and hygiene become difficult in more rural areas. Education becomes really important for that specific population. So then as for guidance of practice, according to a journal published by Health Policy and Planning, Afghanistan's Ministry of Public Health recognizes how health is a basic right for all humans. They are dedicated to graduating and training more skilled birth attendants and sending them to high-risk rural areas, and that would include people like midwives. Basically, regardless of what access women have to healthcare, they should be extended the courtesy of practicing clean and safe delivery. And midwives offer this right to people. Another thing is traveling teams could allow people in rural areas to receive consultations and immunizations without having to travel to a healthcare facility. Afghanistan's cultural values around medicine, being that they prefer to try natural remedies before more modern approaches, should be taken into account before deciding what care needs to be administered. Okay, and then moving on to Iceland. For patient care, like I said, we are comparing one of the best to one of the worst when it comes to infant health and mortality. And so while Iceland's track record is good, reporting less than 1 death per 1,000 live births, there are still places that patient care, teaching, and guidance of practice can be improved. One study published by Science Direct in 2023 discusses the discrepancy between native-born Icelandic women and migrant women in terms of their maternal health care, which we've already kind of discussed. So, yeah. One finding that I found was interesting was just the lack of reliable information that migrant women have about pregnancy and childbirth preparations, and it's mostly due to language and financial barriers. So to combat these issues, healthcare workers such as nurses need to be properly trained to, first of all, recognize implicit biases and also provide culturally sensitive care, which impacts respect and communication. Nurses can also just simply take more time when providing education to make sure that they are that people are understanding them. Then we kind of discussed that they feel like they have less decision-making autonomies in the hospital setting, and this can just apply to all women. And so I think that this can be explained by just rules and regulations of the healthcare facility, but I also think that it can be explained by women receiving antenatal care in other facilities, such as clinics like in their local areas, and then giving birth in hospitals. And so they don't know the staff. So I think nurses can really take time to just get to know the patients a little bit more, even if it's limited, just kind of making that extra effort. That could really build relationships. And then finally, I think there's an aspect to receiving informed consent that is more focused on getting the signature than really giving the patient the best information to make the best decision. So with that in mind, healthcare professionals can improve care by once again taking time to explain what the patient will be receiving consent for, or what the healthcare professional will be receiving consent for, and then the patient will be able to make the best decision for them. So as for teaching, put plainly, with what has already been discussed, women deserve the right to understand the education that's being provided for them, whether it's because they have a language barrier or just because they feel like they're being rushed into a decision. I think the biggest thing is just taking that time with patients and really sitting down and double checking on that education. And yeah, I think that that's really where teaching lacks in the Icelandic medical system, and something that can be improved upon by simply just like a general attitude shift or just a simple policy change. So then finally, for guidance of practice, I really think that just in general healthcare facilities could just hire more translators to provide equal access to that education for those migrant women. And I think care providers should ensure that their practice is evidence-based, so that when they're educating women in the hospital about the interventions that they're using, they have reasons to, or they know why they're doing those interventions, and they can really like make sure that the patients understand as well. But yeah, basically, I think that those are probably the most important things. And I think the final thing I would add for guidance of practice is just making sure that nurses are providing culturally sensitive care. And I think that comes along with just knowing your patients and being willing to learn. And so these are our sources. Thank you guys so much, and we look forward to hearing what you guys have to say. I just click